Hello, everyone. My name is Kristen Hernandez with the blog How to Hyperhidrosis. I'm excited to speak with our guest today, Diana Chow. She's a dermatology PA, and she also has hyperhidrosis. So Diana, go ahead and share with the hyperhidrosis community a little bit about yourself.
Hi, everyone. I'm Diana Chow. I'm a physician assistant here at Houston, Texas. I've been a PA for about 6 years now. Whenever I graduated PA school, I knew I wanted to be in dermatology someday because I do suffer with hyperhidrosis myself in multiple locations. So I'm here to kind of answer all your questions.
Yes, I'm so excited to have you here because I'm also going to start PA school in August. So when I found out you're a PA and you also have hyperhidrosis, I'm like, oh my God, there's others of us out there.
Yeah, congratulations. It's exciting.
Thank you. So just really briefly, when were you first diagnosed, or when did you first have an idea that you had hyperhidrosis?
I basically diagnosed myself. So, it's not very well known, what this condition is because it's so misunderstood,
Right.
I knew that there was something wrong with me when I was like 5 or 6 years old. I knew I was a little bit different from the rest of the kids. There was this one memory I had where, how like those baby M&Ms we have as little kids. So some kid was just passing it around. I was like, oh, I want some too. So he gave me some candy and I held it in my hands for about maybe a minute or so. But whenever I opened my hands, all the coating was all melted in my hands. So I knew I was different. Why are their candies so red and green and brown, but mine's all a hot mess? And so that's kind of how I knew I was different. And so later on, whenever I hit puberty, I definitely started sweating more so in my armpits because, puberty. And I started kind of Googling and I came across the term hyperhidrosis. I was like, that's what I have. That's kind of how I got diagnosed, which is by myself.
Yeah, I think a lot of us self-diagnose because I think I had a similar experience where it was like the Skittles or something like that you're talking about, like where the dye just comes off and your whole hand is like in whatever color. That's such a great example. It's so true.
So I would say my sweating is pretty severe. My hands sweat, my feet sweat. Obviously, whenever I hit puberty, my armpits start sweating too. And that was the first area that I was really embarrassed about because you can't wear anything cute in middle school and high school because everything's you have to cover your armpits. So hands, armpits, feet, and then my groin sweats too. And then it's a really, really bad day, my upper lip too. Really weird, my upper lips as well.
My upper lip as well, yeah. I recently got Botox for my face, and so it helped a little bit with my upper lip, yeah.
Did it change your lips a little bit? Did it give you a little lip flip?
It didn't at all. She just did it superficially because that's what I was concerned about. I was like, I don't want it for cosmetic. I solely want it to stop my sweating. So luckily that helped. But I think the amount of Botox I got was possibly not enough. So I'll have to go in and get more. So we'll see.
They usually last about three months or so. But if it's around the lips, it may actually burn out quicker because you're, caramelizing it a little bit faster. So
that makes sense. Do you, at this time, speaking of treatments, use any treatments for your hyperhidrosis?
So I've used various before, but right now I am 9 months pregnant, so I can't really use a whole lot of things. And that's one of the issues I'm having with, dealing with hyperhidrosis when you're pregnant, right? You have to deal with hyperhidrosis as a population as a whole first, but now you're dealing with a special population. So currently I'm basically using a topical antiperspirant like Drysol or doesn't really work that well because you sweat more when you're pregnant anyway. But there has been other treatments I've used before. Oral medications like glycopyrrolate, Robenol, oxybutynin. These are anticholinergics. Dryonic, which is iontophoresis, the machine that you put in your hands and feet in, over-the-counter stuff. Just not a whole lot right now.
Yeah, I know that can be difficult. I guess that's, because you just don't want to risk anything, obviously. Especially with oral medication. So topicals for you are the safest route at this time.
Right. I mean, you definitely have to check with the OB/GYN if you do become pregnant and, so you can make sure everyone's on the same page because toxicity is a concern if you use something that's not on label. So currently I'm only using topical medication.
Okay, that's good then.
I think it's a combination of hyperhidrosis and just my genuine interest in being in dermatology. I'm a very visual person, so I do like kind of dealing with rashes, acne, psoriasis, and skin cancer. But hyperhidrosis definitely played a big role in my choosing in dermatology, just because I know there's so many sufferers out there who are just like really ashamed and very scared about what they're going through. And just that recognition, just bringing more awareness into this condition overall, I think with my field, I can definitely help and reach out and definitely treat people too.
Yeah, that's great. And what treatment options are you providing for patients that come to your office?
Really all kinds. So obviously, if you do have hyperhidrosis, you start with first line treatments, which is usually topical medications like Drysol, Carpe, that's over the counter, certain dry, clinical strength antiperspirant too. That's your first line treatment. Past that, we have iontophoresis, the machines that you can get that, basically put water and has electricity, kind of shock yourself with the machine. And then you have oral medications if you have multiple areas of sweating. So if you have arms, feet, and palms, you'll do like medication, which will dry out everything. That itself does come with a lot of side effects. So you have to kind of be aware of side effects for all the different kinds of treatments. Past that, there is a surgery called ETS. It's called endoscopic thoracic sympathectomy, which is your last resort. We tend to kind of shy away from the surgery route if we don't really have to go that far. But there are options.
Do you have a lot of patients that have done the surgery, or mostly do like less invasive?
Mostly no, because usually they come in because their primary care provider recommended them to see somebody more specialized in sweating. A lot of times they try like homeopathic things like, sage tea or apple cider vinegar or something, which hasn't really helped. And, I always kind of tell them the options, like first line, second line, third line options. With surgery, there's a lot of problems with it because you get compensatory sweating where you sweat elsewhere. Right. So that's like permanent. So you don't want to do surgery. You really don't have to. I always recommend a website called sweathelp.org, which is actually sponsored by the International Society of Hyperhidrosis. It has great information about treatment, options and what you can learn more about, just about this condition overall.
Yeah, I think it's important to cover all those bases, but to also be cautious, because like you said, compensatory sweating could be almost just as bad as your regular sweating. So.
It's irreversible. Once you cut those nerves, they're cut. Like you can't really reverse it. Despite what they tell you about reversibility of the surgery, you really can't reverse any kind of nerve damage.
Right.
I mean, a lot socially, you're embarrassed. You don't know, you're just ashamed. You don't know what's wrong with you. No one can tell you what's wrong with you. Your family and friends may just like tell you it's nothing. Oh, it's just sweat. It's not a big deal. Just get over it. But they're not really living in your shoes. So I think socially and mentally, it's a big deal. I find that it's as worse as having like psoriasis or chronic eczema because you're dealing with it constantly. And there's not a lot of research about it because it's not really talked about a lot. So that's why our treatment choices are a little bit limited, because we don't have a lot of options because it's not really, well known. So I think mental health socially is a big deal. You definitely, can play a big role.
Do you think it's because it's easier to hide?
Oh, it's definitely.
Yeah. Yeah. You think so?
Yeah. If I was sweating purple and green, that's not easy to hide. But we learn things to kind of hide our sweating. Wearing dark color clothing, black shirts, white shirts. You never wear gray. You never wear satin. You don't wear nice Louboutin shoes because you'll ruin it. So there's a lot of things we do to hide. That's just kind of what we do, and we don't talk about it.
Yeah, and the other things we don't talk about are like the secondary skin conditions. So like I think I even messaged you at one point because I was like, I'm having some fungus issues. Is this something I go to my primary, my dermatologist, podiatrist? Like, I just don't know. And these are things. Like sometimes there's like too many secondary issues that you just don't even want to address it, or you just don't know the right people to go to. And so I went to my dermatologist and they prescribed me iconazole. But when I put it on, it made my feet sweat more.
Even more. Okay.
And I was like, oh, great. I was like, I mean, it's trying to treat one thing, but then it's making the primary issue worse. So like, I don't know. I stopped using it and I've just tried to keep my feet dry in general. But, you know, nail health, eczema, tinea versicolor is something that I dealt with at one point as well. Maybe go into a little bit talking about the secondary skin conditions that patients with hyperhidrosis may deal with.
So when you're sweating a lot, you have that moist environment on your body, whether it's on your feet, on your back, in your groin. Those kind of environments can cause things like yeast and fungus to overgrow. And so you do need to treat your primary condition, which is your hyperhidrosis. So we have to kind of manage that first, because if we treat your toes, your fungus toes or whatever, it's going to come right back because your feet are in that environment of sweating. So having to treat your primary issue, which is hyperhidrosis, is the main thing that you have to start with. Past that, there are conditions like, you know, having athlete's feet, yeast infections vaginally or on the skin, like tinea versicolor, can all be triggered by hyperhidrosis. So, you know, definitely get your hyperhidrosis under control before you treat the other conditions. But yeah, you get a slew of conditions because you're just constantly sweating. And I always tell my patients, it's not your fault. Like, you're not dirty, you're not contagious. It's really not your fault. I mean, it is what it is. I mean, but we have to kind of just deal with it and treat your sweating together as a team. That's all you really can do.
And I think growing up too, I had the tinea versicolor, which it's just for people who don't know, it changes it's a fungus, right? And it changes the color of your skin essentially. So either white or darker. And I was playing sports all the time and I was just sitting in my sweat, and I even sweat more than the average person. So it just exacerbated the situation. But I think it's important just to be cautious of that and just know that, okay, maybe don't sit in your sweat as long. And I know that can be difficult because if you're at work or something, I mean, you know, or in different environments where you can't maybe change your clothes as often, that can be difficult.
So like I said, it's really hard to deal with hyperhidrosis. So whoever that's listening right now, you're not alone. And that's why we're having this conversation, because we want to bring awareness, you know, that there are options out there. You just have to find someone that understands what you're going through and just kind of start from there.
Yeah, that's great advice. And the peeling of skin. I personally haven't experienced the peeling of my hands, but I know some people have. What is that? Okay, so you have that.
I have it. So I have it on my hands. So it's called keratolysis exfoliativa. I know it's a mouthful, but it's a condition where your skin just kind of peels, and it can be actually triggered by hyperhidrosis, because the more you sweat, it kind of lifts your skin integrity, so it's not really intact as much anymore. You have this kind of chronic peeling of your skin. I deal with it all the time. It's always on my right hand. I guess I'm right-handed, so I actually have one here, but that's what it's called keratolysis exfoliativa. Again, no treatment for it. You just have to deal with it.
I noticed that why my nails are maybe a little bit more brittle. It's like, you know, when you get your nails done and they soak your nails, like that's my nails all the time, it feels like.
Yeah, my nails peels all the time. Just because your nails are being soaked by sweat all the time, so it's not very like adherent. It's just so like soaked, and everything kind of peels away a lot more easily for us. So I mean, another thing that kind of sucks that it's so little things that we notice that, you know.
Exactly. It's those, I think that's the main thing too. It's kind of like those little things that no one else maybe pays attention to or notices, but we live with it and we see it on a daily basis, and it impacts like the little daily activities that we do.
Yeah, I mean, I have hand envy. Like, I'll look at someone's hands, like, oh, it's so dry, and their nails are so long, you know, because they have the environment to grow their nails really long and pretty, versus me, shellac, you know. And I have to deal with the embarrassment of like the technician touching my hands. I'm like, I'm sorry, my hands are sweaty. I feel like I'm constantly apologizing for my sweating, which is another thing that kind of really sucks for us, because it's not our fault. You know, we're kind of dealt with this condition, but we have to apologize for it because it's such a social embarrassment, you know?
Right. The last time I got my nails done, they told me, oh, your hands are really sweaty. And I was like, yeah. And she's like, well, it looks like you don't have to work out. Some people have to work out a lot to just sweat, and you don't have to. And I was like, I guess.
Yeah.
I guess so. But yeah, it just speaks to the, I guess, lack of awareness and, consciousness of like what people who actually sweat excessively go through.
Mm-hmm.
And I mean, I've noticed this with providers that I've even gone to myself. So from your experience, do you feel like there's misconceptions in the medical field in relation to hyperhidrosis and how severe it can be?
I honestly think that a lot of providers in general who are not in dermatology, they have no aware that this is even a thing.
Okay.
I mean, I have patients who has told me before that their primary care doctor or their family physician tell me, oh, they will just kind of chalk it up. It's nothing. It's just sweat. It's not a big deal. It's not a real medical condition. So they kind of get shushed away and they just kind of continue to live in the dark. So I feel like there's not a lot of providers, even in family medicine, that's really aware of this condition, that it is an actual medical condition. Mm-hmm. The second thing I've noticed is that a lot of insurance companies will not pay for Botox for hyperhidrosis because they think it's a cosmetic issue. Right. It's not causing you to have low blood sugar, high blood sugar, whatever. Mm-hmm. They don't think it's an actual medical condition. But in contrast, it can actually cause things like you said, tinea bursicolor, fungus on the toenails, yeast infections. Mm-hmm. But they don't really think about that in terms of, financial reasons when it comes to insurance companies. So I feel like a lot of people think that it's a cosmetic issue, but it's not a cosmetic issue. It's a true medical issue. And that's something that needs to change. Mm-hmm. And that's just something that needs to kind of, work through as there's more awareness of hyperhidrosis. I think we really need to have a better understanding that it is a true medical issue.
Right. And even within like dermatology, for example, I had a provider who told me they don't do it at their office, but it's obviously an option I should consider. So I went to a medical spa, got it done, paid over $200 for it. And then I went back for like a follow-up with my dermatologist. They had already left and a new dermatologist came in and they were like, oh yeah, I can do it. And I'm like, wait, you can do it? Oh, like, oh man, like if only I had known, I wouldn't have spent the money. And I understand there's different licensing and training that goes into it, which totally necessary, but it's just kind of disheartening to be like, oh, well, like 2 months ago, I came in for the same thing.
Yeah.
And now it's like hopefully going to be covered through insurance. I don't know what percentage I'll have to pay out of pocket, but she made it seem like, oh yeah, it got approved like the same day, all this stuff. But it was just like, wow, had I known, and I think not just patients knowing, but providers knowing, other providers that know how to do it as an option for patients as well. Because aside from that, you're again just left to like your own devices and figuring out what works for you. And a lot of times it only works sometimes or it doesn't work at all. And you're just stuck hiding again.
Yeah, and I think a lot of providers are just too lazy to do the work. I mean, I'm very blunt. I mean, it is what it is. It's a lot of paperwork that they have to do and appeals and like battling with the insurance companies. I think some of them just really just too lazy to do it. And so you really have to find the right provider who actually cares about this condition. And I think personally, I care a lot because I too suffer with it. And so just have to really find someone that's actually willing to kind of do that extra work for you. And that goes for any kind of providers, right? Whether you're seeing a family doctor or a gynecologist, you want to find one that's really going to advocate for you. So.
Right. And do you feel, I mean, obviously you have your own experience, so you have like a personal interest in the condition, but do you feel like there are enough resources for people or providers who want to help patients with hyperhidrosis?
I mean, there's some. I feel like there's like growth in the whole condition, awareness of the condition in general. Like I mentioned, in the International Society of Hyperhidrosis is a great resource for people. They actually even list PAs now as provider. Like if you want to find a provider near you, there's a search engine in the website that you can find someone that does actually treat hyperhidrosis. So there are more, talks about hyperhidrosis. There's new products that's kind of coming out in the pipeline that's currently being researched. So hopefully one day, we'll have more resources and, to help us bring more awareness and have more treatment options. But I really highly recommend sweathelp.org. I'm not sponsored by them at all. they are really a good resource to kind of start with. And they have information for the patient and for the patient's family members too. So they can kind of understand what that person's going through, and not just kind of, again, chalk it up like it's nothing, because it's not just nothing. It's a big deal.
Yeah, and I think it's important, especially if you're like, I mean, you started around age 4, I started around the same time as well. And I think, I mean, I had difficulty explaining it to my family and them understanding it. So having a resource like that would be super beneficial, so you can just kind of show it to them. Because I remember when the International Hyperhidrosis Society came out with an article that AT&T was considering hyperhidrosis like a disability and or allowing accommodations for, you know, their employees. And I showed that to my family because it was like, look, like this is real, it's proof type thing. Yeah, exactly. And so having resources like that, not just for patients, but their family members, where you can show them and be like, you know what, like this is actually legit. I'm not making this up. This is serious. I want help. And that's the hardest part to begin with anything, is like asking for help. So when you have those resources already accessible to you, it just makes things a little bit easier.
Up, like, you know, I'm not crazy. Like, I really do have a thing that needs to be treated. And like, I also want to mention that I've also tried acupuncture before.
Okay.
It didn't really work. I mean, maybe you were a little bit more relaxed, but it really didn't work. But I mean, I think trying things doesn't, I mean, it doesn't hurt to try things, right? You just have to start somewhere. So
I think we're like pros at trying things. We like people with hyperhidrosis have tried like, well, because you talked about one of your patients trying like tea. I used to try tea bath. Like
there's like
all these different things. Baking soda, like everything. You try everything. You're desperate. You just want, like, even if it's for a few moments of dryness, you want it.
Yeah, absolutely. It's just one of those things that, you know, you learn to cope with it. And I hate doing like icebreakers, like, you know, at a new, you know, the first day of school, you have icebreakers and, you know, have to hold hands. Those are just like so traumatizing for me. So I'm so glad I'm much older now, but it's just it's tough living with hyperhidrosis. It really is.
It is. Yeah, it definitely is. And on that topic, are there any misconceptions that are false information that you've seen in the medical field and presenting information about hyperhidrosis?
Actually, not really. I feel like there has been more talks and more like seminars about hyperhidrosis now. Again, I do a lot of conventions, you know, like in dermatology. So we do talk about a lot about hyperhidrosis, but I guess the biggest misconception is me kind of bringing it back to the point that it's not a cosmetic thing. That's really the deal. I mean, it's really a medical issue, and people should respect it like it is. It's a medical condition. And really kind of focus on that more so than the cosmetic aspect. So.
Well, yeah, and I think that kind of is important, because if you have the information that says it's an issue, you have the treatments that can help with the issue, but you can't get access to it because of insurance or whatever is not considering it a medical issue, then all that like work and all that, those resources are kind of obsolete. Like they just don't, you know, so.
Like with those large, you know, big pharma, to get those funding so we can actually do research and have clinical trials so we can have more options for sufferers like you and I.
Yeah, and I think that's the behind the scenes too that people forget to realize, is like it has to be a profitable condition for research and other companies to invest in it. And so that's why talking about it is important, not just to bring awareness, but because people can invest in the condition and the treatment and getting us the resources that we need.
Yeah, we got to bring awareness somehow. If we don't talk about it, it's almost like as if it's non-existent. So if we talk about it, but we are talking about it right now. Hopefully whoever's listening, you know, it affects about 5% of the population, which is a lot. So it is pretty profitable. So FYI.
All right. So in closing, is there anything you want to add? Any advice? Let's actually tell people where you are. Where are you located?
So I'm actually in Houston, Texas. I work at Bayou City Dermatology. I do have an Instagram, so you guys want to follow me. It's Diana's Derm PA, one word. Yeah, you can book with me if you're in town. If not, you know, again, I recommend just finding a dermatology provider that, you know, specializes in hyperhidrosis. So I'm in Houston.
Great. And I want to thank you, Diana, for joining us today and providing some insight to your experience as a person who has hyperhidrosis, as a medical professional. And again, you can follow her page at Diana Derm, PA.